it's Lacey. Welcome to Fayetteville Pelvic Health. I've gotten a couple of questions this week about standing quad stretches, and I've given it out to a couple of patients, so I wanted to share it with you guys. So most of us kind of know this traditional quad stretch, okay? It's not my favorite. I really like the half kneeling hip flexor stretch. I did a video of it last week maybe. But if you're at work, or if you're standing in line, or if you're running and just don't want to get on the ground, or you cannot get on the ground, this is a good alternative. The important thing to think about when you're doing a standing quad stretch is that if your knee is hanging out in front of you, you're not going to get a good stretch of the quad, okay, because of how the quad and the hip flexor muscles attach. If you have too much of an angle here at the hip, you're not going to get a good stretch. So you want to try and keep your thighs parallel, okay, and you want to keep yourself standing. So this is not going to be nearly as effective as kind of keeping a nice posture, shoulder blades down and back, you're gazing forward. You might want to check in and make sure that your thighs are parallel, and you're going to hold and breathe for about 30 seconds, and you're going to do it on both sides. Okay, so notice I do have a little angle in my back here, a little extension, a curve, but I'm not here. I'm kind of in a nice neutral, straight up and down posture, and my thighs are fairly parallel, okay, and it's hard to see from the front, but easier on this side. My right quad is more flexible than my left, so that's totally normal to find that one side is either more challenging or a deeper stretch. Now this should not hurt. You should feel a stretch, but there's a difference between pain and stretch. So if this is hurting you, you need to find a PT to assess you, or you're not doing it right. So again, find a PT. We are movement specialists. We specialize in looking at your body and tailoring every exercise to you and to meeting your needs. If you cannot grab your leg or your foot behind you, you can always use a chair. I like to do this. I always have my patients do this up against a wall or a table, so that you don't lose your balance, but this can be a nice alternative, and you can always increase the height with pillows, or you can wrap a yoga strap or a leash or a belt and pull it that way. So this is just a good way, if you don't have time to get down on the floor and do a nice deep hip flexor quad stretch, this is a good alternative. But as always, if you have any questions or any doubts that you're doing it properly, find somebody to help you. That's what PTs are for. Yes, I specialize in pelvic health, but I am a physical therapist. I do head to toe. So any of us can help you, even if we are kind of specialists in a certain area. My practice is not limited just to the pelvic floor muscles. It's here down to there, okay? So thanks for watching. Hope you have a wonderful weekend. Hope your holidays are going well. Check out my website if you have any questions about getting scheduled or what I do here, FayettevillePelvicHealth.com, or send me a message, Instagram, Facebook, email. I'm here if you need me. Thank you so much for watching. Have a great day.